David Montgomery of the Chicago Bears went down recently with a very gruesome looking left knee injury, and this was a very concerning one from the get-go because right after the play that he was injured on, we saw that he got up and he of course limped off of the field. Now, whenever you have an injury like this, there is of course a lot of speculation on the severity of the injury and what anatomical structures are involved. Today, we actually found out some information that he did have an MRI, and as of right now, he's been officially diagnosed with a knee sprain. As of right now, sources are saying that Montgomery is due to miss at least 4 weeks of the NFL season, and unfortunately, besides that, we don't have any other additional specific information on the injury. A knee sprain anatomically is an injury of the ligaments in the knee, and there is a grading system for these sprains, and since some people may not be too familiar with that, I'm going to go ahead and focus on that with this video. Welcome, football fans. For those of you that aren't familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them to make them a little bit easier to understand. I also go in depth on what a person should expect when going through the rehab process for that specific injury also. If you like this video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now, you can see right here in the video that the Bears are going to do a run play and Montgomery as the ball carrier. As he runs through the line, he's going to be tackled by a couple defenders, and after the play, that's when he's going to be grabbing that left knee. Unfortunately, as of right now, this was the best camera angle of the injury that I could find, but if you happen to find one, please let me know and I will do a follow-up video on it. Regardless, based on the anatomy of the knee, I can go ahead and speculate on what structure and what ligament seems to be affected. Now, here I have a model of the knee, and so the knee is formed by the femur bone, which is the bone we often associate with as the thigh, coming on down just like this, and then from the lower leg, we're going to have the tibia and the fibula bones. There are, of course, 4 ligaments that contribute to overall knee stability, and they are first the anterior cruciate ligament, or the ACL for short, which is right here. Then as we go towards the inside or the medial portion of the knee, we have the medial collateral ligament, or the MCL for short. As we move towards the lateral or the outside portion of the knee, this is the lateral collateral ligament, or the LCL for short. And finally, as we move to the back here, this is the posterior cruciate ligament, or the PCL for short. There are 2 other really important structures that are located within the knee, and they are, of course, the medial and the lateral meniscus here. You can think of these 2 structures as shock absorbers between the femur and the tibia bones. Without an intact meniscus, you're going to get a lot of bone-on-bone friction, which is oftentimes a lot of discomfort and of course can lead to a person needing surgery. Now, once again, we have not been given any specific details on the specific ligaments that are affected in this injury, but based on the position of the defenders and of course the position of the knee at the time of the tackle, we can kind of speculate and make an educated guess as to what exactly is going on. Now, if we take a better look at that video again, it looks more so like they are tackling him from the outside of that left knee and going this direction. Now, this is called a valgus force, and when this type of force is enacted onto the knee, this is actually going to stress and put pressure through that MCL, or that medial collateral ligament. So based on the video, as what I'm seeing at this time, it's very possible that the MCL is implicated here. It's also very possible that as he was being pulled to the ground, he's getting a force from another direction as well. So if he were getting a force from the back pushing forward, that is going to put an anterior translation on the lower leg, which would stress the ACL. And likewise, if he's getting a force from the front going back, that is going to put a posterior translation on the lower leg, thus stressing the PCL. If there was any medial force going laterally, this is known as a varus force, and you can see right here that when that happens, that is going to stress that LCL. But based on what I'm seeing on the video at this time, it looks like the defenders are more towards the outside of the knee, tackling him inwards, thus placing that valgus force. One other thing that's very possible is that as he planted, his knee could have gone into hyperextension. Now, when we straighten our leg, this is known as extension, and when we bend our leg, this is known as flexion. When we talk about hyperextension, this is when a person is going to go beyond that norm value of their range of motion. And you can see as I go into hyperextension on this model, it is essentially stressing all of those ligaments. So if his knee did in fact go into hyperextension, then any of these ligaments could be implicated. Now, once again, there is a grading system for these knee ligament injuries, and they are of course grades 1, 2, and 3. In a grade 1 knee ligament injury, what you're going to have is you're going to have some stretching of that affected ligament, but there will not be any tearing. In a grade 2 knee ligament injury, basically you're going to have that stretching again, but there will be some partial tearing of the affected ligament. And finally, in a grade 3 ligament injury, you're going to have a complete rupture of the affected ligament. The recovery time frame for a grade 1 ligament injury usually is going to be 1 to about a couple or a few weeks. When we're talking about a grade 2 ligament injury, this is when we're going to go up to a maximum of about 6 weeks, depending on how the person is doing. Finally, in a grade 3 ligament injury, a lot of times this is going to include surgery. So there is going to be a several month recovery time frame with this, depending on the severity of that. So based on the time frame that we are given right now for Montgomery, it looks like he's going to miss at least 4, maybe 5 weeks, depending on the source. Right now, it looks like he is in fact dealing with a moderate knee ligament sprain or a grade 2 ligament injury. Now, when we get somebody in the clinic for a knee sprain, first what we want to do is we want to follow that protocol known as RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. This is very important in the initial phases of the injury because this is all going to help pump and get rid of that inflammation in the knee, because as you can imagine, that person is going to have pain and swelling and a lot of things that are really just going to prevent them from moving properly. Then as a person begins to improve, it usually takes about, I would say, 7 to 10 days or so to get out of that inflammatory phase. But once the person is out of that and they're doing better, then we want to start to restore the normal range of motion of the knee. So essentially, we're going to be providing a lot of exercises that will include for that person to get that full bend or full flexion again. And we want to make sure that they are also able to achieve that full extension. Then as the person's range of motion is progressing, we're going to do a lot of quadricep strengthening, because a lot of times when a person does get a knee injury, the quadricep muscle has a difficult time firing afterwards. So that's going to be really important. And finally, once they've met all the necessary requirements for all of those things, then we can start to add in sport-specific movements. So it does look like Montgomery is going to be missing some time, but he does have a few factors that are definitely going to be working in his favor. First and foremost, he is a professional athlete, so he's already in incredible shape and he's going to be getting the best care possible. Those two definitely really help when it comes to the rehab process. Of course, his age as well. He is very young, which always contributes to having a better outcome. And finally, he's got to be extremely motivated. I mean, so far this year, he's been killing it. He played great last game, so I know that he really wants to get back out onto the field. So although he will be missing time, he does have a lot of factors in his favor. And so I think he'll do very well with the rehab process. But of course, if there's any updates on him, I'll be sure to update everybody in the comment section. And that's it right now regarding David Montgomery's most recent left knee sprain. Once again, if you have any comments or questions, please leave those in the comment section below. Thank you very much for watching today's video. If you like today's content, please subscribe to the channel. Thanks for tuning in, and I'll see you next time.